Hello everyone, my name is Jasmine and I'm going to be presenting diabetes mellitus type 1. To start the presentation off, we're going to be going over a typical patient presentation. So a 12-year-old boy presents with abnormally large amounts of dilute urine and excessive thirst. He also reports significant weight loss over the past week and complains about feeling lethargic. Although he presents with weight loss, he acknowledges that he has an extreme hunger that does not go away after he eats. He also acknowledges that his breath has a fruity smell to it even when he doesn't eat anything with a fruity taste. So, the etiology of diabetes mellitus type 1 is the progressive destruction of beta cells, which are a part of your adaptive immune system, which will eventually lead to insulin deficiency of the pancreas, which then leads to hyperglycemia, which is high blood sugar levels. To go over some background information, we can look at mortality rates. So 2% of individuals with diabetes mellitus type 1 are going to die at 10 years of having the disease. 7.9% of individuals will die at 20 years of having the disease, and 20.4% of individuals will die at 30 years. So to look at the United States, 187,000 children have diabetes mellitus type 1, and 5.2% of adults aged 20 and up also have diabetes mellitus type 1. So to look at the prevalence, there is an increased prevalence in patients with other autoimmune diseases, for example, Graves' disease. And we'll go into more detail about this later, but the leading theory of diabetes mellitus type 1 is that it is caused by autoimmunity. To go further into some background information, I wanted to provide a graph that looks at type 1 diabetes incidences in people aged 0 to 19 years old. So this graph represents the United States statistics, and if you look at the overall, you can see that there has been an increased number of people with type 1 diabetes. And the reason behind this could be due to an increased diagnosis in general. Now let's look at some risk factors. So the biggest risk factor for diabetes mellitus type 1 is genetic susceptibility. So this means that if your parents or other people in your family have this disease, then you are also more likely to have diabetes mellitus type 1. It's also important to note that genetics in combination with environmental factors can also be another risk factor. So an example of an environmental factor could be exposure to certain viruses like an enterovirus. So the reason that this is a risk factor is because exposure to these viruses can lead to an autoimmune disorder. It's also more common in boys, and I should say that the prevalence between boys and girls is pretty similar, but it is just a little bit more common in boys. Alright, now we're going to move on to the pathophysiology. So the exact pathophysiology of diabetes mellitus type 1 is unknown, but as I said previously, the leading theory is that it is caused by autoimmunity. So this is when your immune cells are going to start attacking your own self cells. So in a genetically susceptible person, a viral infection may stimulate antibody production against viral proteins. So this viral infection is going to stimulate antibodies against the viral proteins in order to fight off the viral infection. But this stimulation of antibodies can lead to an autoimmune response against the beta cell molecules. So this means that your own self cells are going to start attacking your beta cell molecules. So the autoimmune response against your beta cell molecules is going to lead to lymphocytic infiltration. And the reason behind that is because your beta cells are hanging out in your lymphatic system. So this autoimmune response against your beta cells is going to cause the destruction of insulin-secreting beta cells of the islets in the pancreas. And that is why this disease leads to insulin deficiency of the pancreas. So this destruction of insulin-secreting beta cells is mediated by the production of autoantibodies. So autoantibodies are antibodies that are going to attack your own self cells. So because we have destruction of insulin-secreting beta cells, your insulin synthesis is going to decrease. And because your insulin synthesis is decreasing, you're also going to have an increase in glucagon secretion. And the reason behind this is because insulin helps take up glucose into your cells. So if you have a decreased amount of insulin, you're going to have an increased amount of glucagon hanging around in the blood and not being taken up by cells. In diabetes mellitus type 1, we're also going to have a decreased secretion of amylin. And amylin is another hormone that is produced by the pancreas, and it is actually co-secreted with insulin. So because we have a decreased synthesis and secretion of insulin, we're also going to have a decreased secretion of amylin. And the function of amylin is to suppress glucagon release from your alpha cells. So because we have that decreased secretion of amylin, that means that we cannot suppress the glucagon release from the alpha cells. And the reason that I bring this up is because it's important to note that not only are our beta cell functions abnormal in type 1 diabetes, but we also have alpha cells that are functioning abnormally. So, the lack of insulin due to the decreased insulin synthesis because of the destruction of insulin secreting beta cells, plus the excess glucagon due to the lack of insulin and also due to the decreased secretion of amylin is going to lead to hyperglycemia. And hyperglycemia is defined as high blood sugar. So you're only going to have hyperglycemia in a type 1 diabetes patient when 80 to 90% of the beta cells are destroyed by that autoimmunity. In type 1 diabetes, we're also going to have an increased metabolism of proteins and fats due to the lack of insulin. So because we have a lack of insulin, there's not as much glucagon being taken up in the cells. So when you eat food, you're not going to have any glucagon to turn that food into energy. So that's when your body resorts to increasing the metabolism of proteins and fats so that you can have energy. So, the increased metabolism of proteins and fats is going to actually result in weight loss. And that increased metabolism of proteins and fats is also going to lead to diabetic ketoacidosis. So, that increased metabolism of fat is going to cause high levels of circulating ketones because when you metabolize fats, they release ketones. So, the more we metabolize these fats, the higher chances you are to have diabetic ketoacidosis in a type 1 diabetes patient. Alright, so now we're going to look at the symptoms. So the first symptom that we're going to go over is polyuria. So polyuria is defined as abnormally large amounts of dilute urine. So the abnormally large amounts of dilute urine is due to the increased blood glucose levels. And the reason behind this is because since you have an increased amount of glucose levels in your blood, once your blood reaches the kidneys for filtration, you're going to have an excess amount of glucose. So when filtration is going on, that glucose is actually going to pull in water. So because we have a lot of glucose in the blood or in the filtrate, a lot of water is going to be pulled into that glucose. So when the patient who has type 1 diabetes goes to urinate, there's going to be abnormally large amounts of dilute urine because of the abnormally large amounts of water being pulled into that filtrate because of the high blood glucose levels. Our next symptom is polydipsia. So polydipsia is defined as excessive thirst. So in relation to the symptom that we just looked at, this is also due to increased blood glucose levels to note, but because our kidneys are excreting abnormally large amounts of dilute urine, that means that our body is losing a bunch of water when we urinate. So because our body is losing a bunch of water, you're going to feel thirsty because your body doesn't have as much water as it thinks it needs. The next symptom we have is polyphagia, which is defined as an increased appetite or excessive hunger even after you've eaten a meal. So polyphagia is also due to your increased blood glucose levels. So because we have an insulin deficiency, that means that glucose is unable to enter our cells. So when we're eating a meal, the body is not able to convert that food into energy. So, even after you've eaten a meal, because your body is unable to convert that food into energy, you're still going to have excessive hunger or an appetite even after you've eaten. Alright, so now we're going to look at hyperglycemia, which is more of a sign than a symptom. So as I said previously, hyperglycemia is high blood sugar, and it can only occur when 80 to 90% of the beta cells are destroyed. And we've already gone over how the lack of insulin in combination with your excess glucagon hanging out in your blood is what is going to lead to that hyperglycemia. Our next symptom for type 1 diabetes is weight loss. So weight loss is due to the increased metabolism of proteins and fats. So we've already gone over how there is an increased metabolism of proteins and fats because your body cannot use the glucose to convert your food into energy. So it's going to start metabolizing proteins and fats in order to convert your food into energy. Our last symptom that we're going to look at for type 1 diabetes is fruity smelling breath. So the reason that these patients have fruity smelling breath is due to the ketoacidosis. So because we have that increased metabolism of fats, once we metabolize fats, they're going to produce ketones. And this will lead to high levels of circulating ketones. And the ketones are what is going to produce that fruity smelling breath. Alright, now let's look at the diagnosis of type 1 diabetes. So an easy diagnosis of type 1 diabetes is the presence of diabetic ketoacidosis. So we've already gone over how diabetic ketoacidosis is due to your increased metabolism of proteins and fats, which will cause those high levels of circulating ketones. Another way we can make this diagnosis is by a serum measurement of C-peptide. So this serum measurement of C-peptide will actually measure the amount of C-peptide in your blood or urine. Now you may be wondering, why are we looking for C-peptide in the first place? Well, that is because C-peptide and insulin are actually released at the same time from the pancreas, meaning they're co-secreted, and they're actually co-secreted in similar quantities. So this means that a C-peptide test can actually show how much insulin your body is making. Therefore, if you have a low level of C-peptide, that also means that you have a low level of insulin. Alright, so we're going to end this presentation off by talking about some treatments. So our first and most important treatment would be insulin therapy. So because we have a decreased synthesis of insulin in our bodies, we want to get more insulin into our body. So therefore, insulin therapy is going to have you inject insulin into your body in order to increase that synthesis. So insulin therapy will actually reverse your catabolic condition. It will prevent that ketosis. It'll also decrease your hyperglucemia, which is an excessive amount of glucagon in your blood, and it will normalize your lipid and protein metabolism. Another treatment for type 1 diabetes would be meal planning, so going on a diabetic diet. Since we have high blood sugar levels, we want to have a diet that will definitely not increase your blood sugar and will actually help to lower your blood sugar as well. So some things that could be eaten on a diabetic diet would be things like whole grains, vegetables, and fruits. And our last treatment would be our islet cell, stem cell, and or pancreas transplantation. So as we went over in the beginning of this presentation, the leading theory of diabetes mellitus type 1 is autoimmunity. So if we're able to transplant our islet cells, our stem cells, or our pancreas as a whole, that means that we'll be getting new cells that aren't experiencing autoimmunity and won't be attacking each other. And here are my references that I used for this presentation. I hope this video helped you guys learn more about type 1 diabetes.